First off, I just want to welcome you here. Thanks a lot for coming.
Happy to be here.
We're excited to have you here. Tell a little bit more of the story, not just of the hospital system, but your hospital systems and how they all integrate together. You got a couple topics that I think we want to touch on in terms of new services, how EMS has evolved, but maybe I'll just start it out with, tell me a little bit about yourself. I think folks would like to get to know you.
Sure. So I grew up in the great state of Tennessee, so I'm a diehard Tennessee fan of all things Tennessee, especially football, but basketball, basket weaving, you name it, I'll watch it. So,
Really?
I grew up there in Nashville, Tennessee, and went to the University of Tennessee to get a degree in computer science. Went down that track for a while and ended up getting my way into healthcare. So I got a master's degree and went into a training program where they treat you pretty rough there for a while as an intern, sending you all over the place trying to get you experience. But here I am 15 years later in healthcare, and a lot's changed, and I've learned a lot and got a lot of different experiences along the way. So,
what is it about Tennessee that makes it such a hotbed for healthcare?
It started with a few of the larger healthcare corporations being based there. HCA was one of the big companies that early on was founded in Nashville, Tennessee. And as time went by, more spin-off companies came of those larger corporations. And it was easier to base yourselves in Nashville, where the corporate employees, all the other healthcare, the talent is. So it was easier to start up a company there than somewhere else and convince people to move. And 30 years later, 40 years later, now you have a healthcare hub of the United States being in Nashville. Not many people know that, but healthcare is a big deal in Nashville.
What's your perspective? Been here a couple years now. What's your perspective of living in Northwest Indiana?
It's great. Actually, I compare Valparaiso very much to my hometown. That was Franklin, Tennessee, where I grew up. A lot of similarities. So small town feel, but a very well educated, very progressive area. And it's a unique balance that you don't find many places. Sometimes you're either too secluded and out in isolated area, or you're too attached to a large city and you become kind of gobbled up. Valparaiso, Chesterton, this area really has a unique feel where it's very supported by the people that live here, and people have a lot of pride in living here, and that's great to see.
But you're still an hour's drive from Chicago. You can hop into the city at any time, but you feel like you're out in the country a little bit.
Yep.
Tell me a little bit about Porter. I don't know that everybody necessarily knows all the tangents of Porter Healthcare System and how they all interact a little bit. Tell me about the different divisions, so to speak.
So Porter started out, the history there is it started out as a community-based hospital in downtown Valparaiso, and over time has transitioned to be more of a regional referral center and has morphed into a health system rather than just a traditional hospital. We're up to about 2,300 associates at Porter, and that's really where it all starts. It's all about the people that work there. I think we have some of the best people in the United States that work at Porter, and it really is our foundation. And you talk about who is Porter. Well, it's those 2,300 people. We have great physicians, we have great staff there, and very committed to this area, to the community, to Northwest Indiana. As you've seen Porter grow and change into the referral center that it is, we've also branched out into more outpatient strategies. So we have somewhat of a hub and spoke model at Porter. It's not just the hospital there that sits on 49 that you see when you drive by. It's actually major outpatient facilities in each of the key markets that we serve. So we have a center in Valparaiso on Roosevelt Road we call Valparaiso Medical Center. That's got a freestanding emergency department, surgery center, imaging center, pain clinic, wound care center, lots of physician offices in and around there, diagnostic imaging, those types of things.
It's grown a ton just over the last year or so.
Absolutely, and the whole idea is that if you live in that Valparaiso community, you can get 80–90% of your healthcare needs met right there without having to go to a hospital unless you need to be admitted or need a subspecialty consult, something of that nature. We've replicated that same concept in other communities. So Portage is another great example. We have more of a full service facility there, but emergency department, urgent care, surgery center, imaging lab, inpatient rehab, physician offices in and around there. imaging, the whole nine. So again, people that live in that Portage community and around Portage have a lot of healthcare access right there. We've got a scaled down version of that in Chesterton. So it's really become a pretty massive health system over time.
You're not saying everybody come to us, you're saying actually we're going to go to you.
That's right, and the future of healthcare is outpatient. So we're doing more and more trying to keep people out of the hospital. And in order to do that, you need a lot of access points. You need to be convenient, close to where people live.
Tell me a little bit about the whole networks, that connects out into LaPorte County and Stark County. Tell me a little bit about the broader, health system.
Yeah, so we're very committed to this area, to Northwest Indiana. We think Northwest Indiana is one of the best places to be. So we actually asked our parent company to go out and look for other opportunities. And LaPorte is not owned by Porter or anything of that nature, but our parent company did acquire the majority interest in LaPorte and Stark hospitals. So now, we're looking for ways, how do we cooperate together? How do we provide healthcare services to the greater area smarter and better together than what we could do as individual facilities competing? I think over time you're going to see this just be better and better. We've got a great team over there that's working on building a new hospital in LaPorte, and then they'll work on building a new facility down in Stark. So we'll have great facilities here, great people, and obviously Northwest Indiana has been very supportive of us, so we're just thrilled to have the opportunity to do it.
Probably a misconception. Porter doesn't own those hospitals.
No. Yeah. Everybody asked me that question, and no, thankfully, I've got a day job at Porter. We don't own them or operate them. It's a separate entity. We each are very focused on the communities that we serve and providing the very best health care that we can to them. So over in LaPorte, they're doing that exact thing. They're coming up with their own strategies, their own plan to make sure that we address the needs of our local communities, just like we do at Porter.
From a EMS standpoint, that's been an area that quite a bit of evolution has happened over the last few years. Just touch on how that all works.
Yeah, sure. So we have the county contracts. We provide services to the county. We're not the only ambulance provider here. There's lots of different ambulance providers, both independent ambulance providers as well as groups that are contracted with local municipalities. And we provide backup to those folks, and they back us up in return. So it's a really good relationship, and we cover the entire county of Porter County. And we also do a lot of medical oversight of those other services, or many of those other services, to make sure that we're all kind of working in conjunction, that we're all using the same protocols, that type of thing. And it's been great to see. We have a great team of paramedics and EMTs out there that answer these 911 calls every day. And they come back with some pretty amazing success stories of how they've been able to go in and save people's lives. And I'll tell you one thing, being on the hospital end of it too, if they do a great job, it makes our job in the rest of the health system so much easier if those patients come in better shape and prepared for their hospital stay.
Well,
so
those are
they
their
do a
critical
great job.
moments. So
Yeah.
if they're doing their job, they're coming to you in much better shape in the first place.
Without a doubt. And it's thankfully we have a really good team out there that fights those battles each and every day for us. So.
Hospital services are changing quite a bit in terms of not necessarily evolving the services, but new services being offered. So what are some of the hot spots right now in terms of programs that you're offering or new services that you're offering?
So we're always trying to add new services and raise the level of care at the hospital. I did want to touch on a couple unique things that we've started recently. One is we're trying to get more into the technology world and try to be more convenient for patients. So we did sign on with a company called InQuicker. We have an online scheduling system now for all of our ERs, for all of our urgent care centers, as well as several of our primary care physicians. So now if you go to Google today and type in emergency room, your local emergency room will pop up, the closest one to you of ours that we have, and you'll be able to schedule yourself in there. So rather than calling and making an appointment, say for an urgent care visit or primary care office, now you can literally plug yourself in. It lets the staff on the other end know, the physicians know that you're coming, kind of what you're coming for, and it holds your spot in line.
So literally the same Same kind of technology, obviously a lot more advanced, but the same kind of technology that you're ordering at Chipotle or
Yep.
making your restaurant reservation or whatever it is, you're trying to bring all that technology into patient care to ultimately make it easier for the patient.
If there's one thing we've learned over the last 15 years or so, it's people don't like waiting in waiting rooms. And that's true no matter what industry you're in, but especially in healthcare when people are sick and needing healthcare services timely. People do not want to wait. And so this is a way they can cut out some of that wait time, make sure that we start the process early before they even arrive to the facility, and get them cared for timely. So it's been really a huge success for us. We've seen a lot of utilization in the urgent care centers, the ERs, and the primary care offices. So.
I guess this technology is just completely transformed almost every aspect of healthcare, from patient records to, engagement with people, making sure that they've got access to things.
It's all about communication and timeliness, and that's a big part of what we do. So we're looking for ways to be more creative and to reach out to people and kind of meet their expectations or their needs. The other big product we've signed on with is something called MD Save, and that's a company that does special pricing for outpatient tests mainly. Really, we target people with high deductible insurance plans. It's been a big trend over the last few years. Certainly hear about insurance in the media a lot nowadays, pretty much every day. But one of the big trends we've seen are the high deductible plans where people feel like they don't have insurance, they don't have full coverage for the care that they need. So we signed on with a company that does big discounted pricing. It works kind of like Amazon or something of that nature. You get to go online, check out if you need a MRI or a CT or a lab test, put it in your bucket, check out like you would on Amazon.com, pay with a credit card or your health savings account up front for your MRI, and then you bring in your voucher saying, I'm here for my MRI, and it's all paid for up front. And you get a big discount on the price for doing it that way.
Well, for the patient, it also probably relieves a heck of a lot of stress, because otherwise, a lot of times you're going to the hospital and you're saying, or you're going for that test and you're saying, I have no idea what this is going to end up costing me. Yeah. I'm nervous as heck about the test in the first place. That's right. And I'm also nervous what the heck it's going to actually cost me.
And the historical or traditional billing process in healthcare has been really challenging. It definitely is more cumbersome and confusing to the individual than it should be. And so this is one way that it's very transparent, all on the front end, right at your fingertips. Before you ever set foot in a facility, you know what it's going to cost you and the process to get it done. So it's been a really good thing as well. If you go to mdsave.com, there's also an app you can download, but if you just go to mdsave.com, most of our testing is listed out there with all the prices. It's also a bundled price too, which is pretty neat. So it includes, if you're getting an x-ray, it includes the radiologist fee, or a lab test, it would include the pathologist.
So the traditional challenge that the person has that says, oh, okay, I thought it was going to be X number of dollars, and then you're like, but it doesn't count in this, or it doesn't count in this, or suddenly the Advil, cost, or something else is jumping in there. So you got a lot more certainty.
That's right. So that's the whole idea, is that it's transparent, it's clean, it's quick. And so far we've had a lot of utilization. We really haven't done much marketing with it, just to kind of work through a lot of the kinks early on, but it's been great. So I encourage anybody to go try it. If you need a lab test or an imaging test by your physician, you got that order in hand, just go online and check out what the price is going to be before you even get there, if you have one of those high deductible plans. So if you've got a couple $1,000 deductible, $5,000 deductible, and you need a MRI that's going to cost a couple $1,000, you might want to check that price before you go in for the test.
Yeah. Tell me a little bit about your community involvement. We see folks from Porter at darn near everything. You're either participating or sponsoring or leading or volunteering. There's people from Porter at almost everywhere. Yeah. Whether it's a community event, it's a nonprofit, it's a chamber activity, whatever it is. Tell me a little bit about your community involvement and how you're giving back.
So for starters, it does start with our associates. So when you employ 2,300 people in a town around here, you end up being involved just because you touch a lot of families, and your associates live in a lot of neighborhoods and they participate in a lot of events and that type of thing. So we are very involved that way. But additionally, we are represented pretty well in most of the major community events and organizations in the area. We have a pretty structured approach to that, and are fortunate to be able to participate in a lot of different things. I will say it's one of the challenges too. As you go from a community-based hospital where it's downtown Valparaiso and you're involved in everything in Valparaiso, to being more of a regional center, all of a sudden, the obligation is there more so than it ever has been to be involved in everything. So we really try to mix it up and get involved in things all over Northwest Indiana, and that's been one of our big efforts. But we have a lot of impact on the community. We employ a lot of people, 2,300 jobs that between what we pay out in salaries and what we donate and our taxes and all of that, comes to somewhere around $150 million a year of benefit that we provide to the community just from being here. And that's a pretty big message.
By far, from Porter County standpoint, by far the largest.
I don't know. I haven't looked at the statistics. I know the steel companies are still pretty big players around here, but as far as Porter County goes, we rank up there, I'm sure, in the top couple of employers.
Couple that you're putting a little bit more time and attention into this year. I know you've got the Heart Association, I think it is.
Mm-hmm. We signed a multi-year partnership with the Heart Association about a year and a half ago that allows us to do fundraising in a much bigger way for them. And it's great. Actually, our associates came to me and asked me if we would participate in a bigger way. And so we signed the partnership to see how it would go. And it's been a pretty overwhelming response. Our associates really got engaged. They started fundraising. We went to the Heart Walk last year, the American Heart Association Heart Walk for Porter County, and had over 200 walkers from Porter show up. All in bright green T-shirts that they helped design. Yep, and then they raised, I forget the total number, it was over $20,000 or so that they raised for the Heart Association last year. This year they're well on their way. They've started fundraising already, and lots of bake sales and fun activities for associates and other people to get involved in. They did a couple of Easter egg hunts and that type of thing. It's just been fun to see. It's fun to see when your associates get excited about something, especially when it's for a good cause. It just gets everybody more engaged. So I think you'll see us more and more. Hopefully, we're going to far exceed our targets from last year for this year's Heart Walk, and we've got some good teams already working towards those goals. So.
It's probably nice to see them competing and actually vying to.
And it gets competitive too.
Do good for a cause,
Yeah, it gets very competitive. We got a couple departments that have really gone head to head or toe to toe with some of the fundraising efforts. So. Yeah.
Well, my guess is you got to focus an awful lot on the business side of healthcare. So it's probably nice when you actually get to connect on the patient side of healthcare, but also just on the community side of healthcare. I mean, you're a huge employer that is essentially caring for the community, not just providing a business.
Yeah, it is all about people. It's about our patients, it's about our associates, it's about our physicians, and when you stay focused on people, a lot of the other stuff that you read about in the news and Trump care and all that other stuff, I think kind of goes by the wayside. If you just focus on doing the right thing for the patients, the right thing for the people, all the rest of it's going to work itself out in the end.
Well, and you guys got to stay adaptable, and whether it's Trump care, Obamacare, or whatever the next care, or whatever the previous two cares are, you got to really stay flexible and ultimately help people understand all that, because that's probably one of the biggest challenges as a consumer of healthcare is, how's this all work now? What am I eligible for? What am I not eligible for? What's in network, out of network? It's a lot more complicated maybe than it used to be. So you guys, as almost a counselor on healthcare, I think are taking an even more important role.
If there's one thing we've learned here in this last few years, it's that healthcare is very resilient. And I don't know what the future holds as far as the insurance plans and what will be government assisted or not and all of that. But the one thing I'm pretty confident of is that we're going to continue to be resilient. I know it's been very confusing for the public. It's been very confusing for us in healthcare too. But we're here. We're a mainstay in Porter County, and we're here to help. So please, if you have any questions or concerns, you can always come talk to us, and we'll try to figure it out together. So,
anything else you want to touch on you'd like folks to know about that you've got upcoming?
We've probably the most direct thing, we've got some new physicians coming. We've been recruiting pretty heavily over the last several years. We've had a lot of new docs start over the last couple of years in particular. We have a few more that are starting this summer. So we've got a couple primary care physicians, Dr. Barakat and Dr. Anderson, that are coming to Valparaiso this summer. We have 2 medical oncologists, Dr. Redsick and Dr. Brake, that are starting this summer. And we've got a urologist, Dr. Pinkasoff, who's starting this fall. So we've got some physicians that are starting up their practices here soon. If you need healthcare services and that sort of thing, these people are going to be out there trying to build their practices, getting involved in the community, all those types of things. So real excited about them, and excited to get to have the community meet them, because the hope is that they're going to be here for a long time to stay. So that's.
Well, thanks for the update. We'll look forward to having you back and keeping you in touch with our folks, and our folks keeping in touch with you. And we'll undoubtedly see you at a couple of dozen events over the summer.
Yeah, great. I appreciate the time, and it was nice talking to you.
Thank you.
Yep. Thanks, Chris.